Welcome. Have you ever felt bloated after eating or experienced persistent abdominal discomfort? You might be dealing with small intestinal bacterial overgrowth or SIBO. In this video, we'll break down everything you need to know about SIBO from its causes to its treatment, helping you understand and manage this common digestive issue. Let's dive in! So, what causes SIBO? The root of the problem lies in an imbalance of bacteria in your small intestine. Normally, the small intestine has a relatively low bacterial count compared to the large intestine. However, in SIBO, bacteria from the large intestine, or even bacteria that are not normally present in the digestive tract, migrate upwards and colonize the small intestine. Several factors can contribute to this bacterial migration and overgrowth. These include structural abnormalities in the small intestine, such as strictures or diverticula, motility disorders, where the normal muscle contractions that move food through the digestive tract are impaired, conditions like Crohn's disease or celiac disease that can damage the small intestine, immune system deficiencies, and even certain medications like proton pump inhibitors, APPIs, which reduce stomach acid and can alter the gut environment. Also, prior abdominal surgeries can also sometimes contribute. Let's talk about what happens inside your body when SIBO takes hold. The excess bacteria in the small intestine start to ferment carbohydrates, including sugars and starches, which results in the production of gases like hydrogen and methane. This fermentation process leads to bloating, abdominal pain, and excessive gas. Furthermore, these bacteria can interfere with the absorption of nutrients, particularly fats and fat-soluble vitamins, as well as vitamin B12. This malabsorption can lead to nutrient deficiencies, which in turn can cause a wide range of symptoms, from fatigue and weakness to neurological problems. The inflammation caused by the bacterial overgrowth can also damage the lining of the small intestine, further impairing nutrient absorption and contributing to leaky gut syndrome, where substances that should stay within the digestive tract leak into the bloodstream. SIBO is more common than you might think, though exact prevalence rates are difficult to determine. It's often underdiagnosed or misdiagnosed as other digestive disorders like irritable bowel syndrome (IBS). While SIBO can affect people of all ages and backgrounds, certain groups are at higher risk. These include older adults, individuals with underlying medical conditions that affect gut motility or immune function, and those who have undergone abdominal surgery. People with conditions like diabetes, hypothyroidism, and autoimmune diseases also appear to have a higher risk of developing SIBO. It's important to note that SIBO can significantly impact quality of life, so proper diagnosis and management are crucial. The signs and symptoms of SIBO can vary from person to person, but there are some common indicators. The most frequently reported symptoms include bloating, abdominal pain or discomfort, excessive gas, diarrhea, and constipation. Some individuals may also experience nausea, vomiting, and loss of appetite. In more severe cases, SIBO can lead to unintentional weight loss and signs of nutrient deficiencies, such as fatigue, weakness, and even neurological symptoms like brain fog or difficulty concentrating. Because many of these symptoms overlap with other digestive disorders, it's essential to consult with a healthcare professional for proper evaluation and diagnosis. Diagnosing SIBO typically involves a combination of medical history, physical examination, and specific diagnostic tests. The most common test is a breath test, which measures the levels of hydrogen and methane in your breath after you consume a sugar solution, typically lactulose or glucose. Elevated levels of these gases suggest bacterial overgrowth in the small intestine. Another diagnostic option is a small intestinal aspirate and culture, where a sample of fluid is taken from the small intestine during an endoscopy and analyzed for bacterial growth. While this method is considered the gold standard, it's more invasive and not always readily available. It is also important to rule out other potential causes of your symptoms through blood tests and stool tests. While SIBO is generally classified by the causative bacteria, it's more clinically relevant to consider the predominant gas produced by the bacteria. This leads to two main types: hydrogen, dominant SIBO, and methane, dominant SIBO, sometimes referred to as intestinal methanogen overgrowth and IMO. Hydrogen, dominant SIBO is often associated with diarrhea, while methane, dominant SIBO is more commonly linked to constipation. A third type, hydrogen sulfide SIBO, is less well understood but may be associated with symptoms like sulfurous burps and gas. Identifying the predominant gas can help guide treatment strategies. The primary goal of SIBO treatment is to reduce the bacterial overgrowth and alleviate symptoms. The most common approach involves antibiotics, particularly rifaximin, which is poorly absorbed and primarily targets bacteria in the gut. In cases where methane-producing bacteria are dominant, a combination of rifaximin and another antibiotic, such as neomycin, may be used. Dietary changes are also crucial in managing SIBO. A low-FODMAP diet, which limits fermentable carbohydrates, can help reduce the fuel available for bacteria to ferment, thereby reducing symptoms. Some healthcare providers may also recommend elemental diets, which are liquid diets composed of easily absorbed nutrients, essentially starving the bacteria. Probiotics may be used in some cases, but the type and strain should be carefully selected under the guidance of a healthcare professional. Addressing the underlying cause of SIBO, such as structural abnormalities or motility disorders, is also essential for long-term management. Preventing SIBO involves addressing the underlying risk factors and maintaining a healthy gut environment. This includes managing conditions like diabetes and hypothyroidism, avoiding unnecessary use of antibiotics and proton pump inhibitors, SIPIs, and addressing any structural abnormalities or motility disorders in the digestive tract. A healthy diet rich in fiber and low in processed foods and sugars can also support a balanced gut microbiome. Practicing good hygiene, such as thorough hand washing, can help prevent the introduction of harmful bacteria into the digestive system. Regular exercise and stress management techniques can also promote healthy gut motility. The prognosis for SIBO varies depending on the underlying cause and the individual's response to treatment. In many cases, SIBO can be successfully treated with antibiotics and dietary changes, leading to significant symptom relief. However, recurrence is common, particularly if the underlying cause is not addressed. Long-term management may involve ongoing dietary modifications, intermittent antibiotic therapy, and addressing any underlying medical conditions. Recent research is focusing on novel diagnostic methods, such as advanced breath testing techniques, and exploring alternative treatment options, including herbal antimicrobials and fecal microbiota transplantation (FMT). Studies are also investigating the role of the gut microbiome in SIBO development and potential therapeutic interventions that target specific bacterial species. As our understanding of SIBO evolves, so will our ability to effectively diagnose and manage this complex digestive disorder.